All right, guys, welcome back. So today we're going to be talking about headaches. There's about 100 different things that cause headaches, but the research shows that the most common cause of a headache is lack of oxygen and blood flow to the brain. So as a chiropractor, one of the first things I'm going to do with anybody coming in to see me with headaches is I'm going to evaluate their upper neck. So one of the ways we're going to do that is specific x-rays, of course. But when we look at the upper neck, you can see the red right here. That is arteries. So that's blood flow from the brain to the body back up to the brain, right? So if there is a misalignment in this region of the spine, that can be restricting some of that blood flow to the brain. Along with that is the nerves. So the nerves is how the brain communicates with the body, and the body communicates back to the brain. So when there's a misalignment in that region, that could be putting tension and stress on the nerves as well. So both of these two components are essentially what lead to headaches in a lot of these different cases, and why people get such good results with chiropractic care, because when I make a safe, gentle correction in this region, I'm going to take pressure off of the nerve, and I'm going to allow the blood flow to move more smoothly. There's actually a lot of really good research from a specific technique called NUCA, but this is a technique that has done a lot of research with chiropractic and blood pressure. Getting a upper cervical adjustment in your neck will actually lower blood pressure in many circumstances. I was actually lucky enough to do a mission trip in India where I was able to test this myself, and I only tested about 20 different patients because we were busy on the trip, but all 20 of those patients that I worked with before and after had improvements in lowering their blood pressure. So that alone can help with a headache, let alone the postural benefits that you'll get from leveling the head, the shoulders, any sort of compression that you might feel just from sitting, slouching, all of these things that we're typically doing day to day, whether it's work, phone, couch time, watching the game, whatever it may be. That posture can also limit that blood flow to the brain. So you want to get your neck x-rayed, you want to get your posture evaluated and see if you're dealing with any upper neck tension and stress with your nerves and your vascular tissue. So if you're at home and you want a little quick remedy to try to get rid of that headache, you can't get to the chiropractor, it's Sunday, whatever it may be, deep breathing exercises is one of the best ways to calm your nervous system down and actually help with a headache. So one of the techniques I love is called 4-7-8 breathing. It's a 4-second inhale, 7-second hold, and an 8-second exhale. If you don't like doing math, it's okay. You don't have to count. The point is to hold that breath in and then have a longer exhale than an inhale. This is going to immediately lower the tension in your entire body. It's going to help with your overall stress levels, and that alone is going to get a lot of oxygen to your brain, right? So we're going to get natural blood flow to the brain just by breathing. A lot of you guys out there are sitting, we're shallow breathing, we're not really getting oxygen to the deep tissue of our lungs. So try the 4-7-8 breathing if you're at home battling with those headaches. Thanks for tuning in today. We'll catch you on the next one.